There continues to be some encouraging news in the battle against COVID-19, with the number of new cases down 35% in a week.
However, the CDC is very concerned that there's been an increase in the number of teenagers with COVID who have ended up in the hospital. Dr. Frank George here with more on a very troubling trend, Doc.
Yeah, Karen and Devin. So we've seen the incredible impact that vaccinations have had in adults, dramatically decreasing the number of cases and hospitalizations. But there has been a very clear shift now in who's getting sick. In May, 24% of all new cases were in young people, mostly teenagers, and some of those teens are getting very, very sick. With more adults now protected, COVID-19 is targeting teens.
I want to highlight a specific population that we were hoping will join the tens of millions who have already been vaccinated, and that is adolescents.
A CDC report shows an increase in the number of young people hospitalized with COVID-19 this spring.
More concerning were the number of adolescents admitted to the hospital who required treatment in the intensive care unit with mechanical ventilation.
In the first 3 months of the year, nearly 1/3 of those aged 12 to 17 hospitalized with COVID-19 needed to be admitted to the intensive care unit. 5% required a ventilator. About 70% of those hospitalized had at least one underlying medical condition, the most common being obesity. But nearly 30% were completely healthy before COVID. The CDC says increased hospitalization rates in teens may be related to the rise of more infectious variants and the number of children returning to school. It's all fueling the push to get more of those aged 12 and up vaccinated.
The level of severe disease, even among youth, that are preventable, that force us to redouble our motivation to get our adolescents and young adults vaccinated.
Now, about 24% of kids aged 12 to 17 have now received at least one dose of the Pfizer vaccine. And health officials say for teens to return to a more normal life, they need to get vaccinated.
Frank, what about the situation then facing children under the age of 12? So many parents we've talked to and we're hearing from face this real dilemma as all of these precautions are being dropped, even without a lot of answers for those parents.
Yeah, they're definitely in an odd situation. It is important for families to keep following precautions to protect younger kids, but I know that's becoming more difficult as things open up.
Right.
Now, the FDA's Vaccine Advisory Committee, they're going to be meeting on Thursday to discuss what will be required to consider authorizing vaccines for children under 12. And that's likely going to include how many months of follow-up they want to see and what level of efficacy is the goal. That meeting should give us a much better idea of the timeline for a vaccine for kids under 12. But in the meantime, parents just need to be cautious with their little children.
We will be on that meeting later this week. All right, Doc.